Medicare's going broke. And it's going broke not only because $700 billion was taken out of it to pay for the President's Affordable Care Act, but another $300 billion are going to be taken out in the physician payment formula.
Right now, the way Medicare is organized, the trust fund will be out of money within 10 to 12 years.
The payments to physicians are so low already, it's hard to find that primary care doctor. It's hard to find that specialist who needs to take care of you, and the problem is only going to get worse.
Seniors really need to understand the threat to Medicare as we know it is this Affordable Care Act. And it has changed Medicare as we know it for our seniors. And this law will affect everyone who's on Medicare.
The President's health care bill doesn't fix the problem with health care. The problem with health care is it's too expensive.
So we've heard from the hospitals and the physicians, they're not happy with this law. We've heard from the seniors, they're not happy with this law. I hear from my businesses, my small businesses, those entities that we're trying to get this economy going, and they're concerned because they don't know how this law is going to affect them.
Americans understand that when you put the government in charge of something so vital and personal as health care, real problems can occur.
I mean, there's definitely needs to be room for improvement in our system, but can we have this conversation in an open fashion? I mean, I think a lot of people, even on the other side, would realize that, hey, we made a mistake. But isn't it more important to admit that we made a mistake and try to move forward in a fashion that actually cuts costs?
With the Republican proposal for Medicare, anyone who's 55 and above can take a deep breath and they can say, my contract with this country, my benefit through Medicare will not be touched, and I can rely and count on that. That's a very important promise that we can make to our seniors.
Every American either has a pre-existing condition or will have one in their lifetime. So our plan will have to deal with it, and it does deal with it. And for those people who want to have their children on their policies up until age 25, our plan can deal with it and does deal with it.
The responsible thing to do is enact true health care reform that will really reduce the cost of health care, that will allow patients choice.
We actually let market forces work, providing the same coverage that you get, that people in Congress get, and it will work.